With all our hearts, we pray and ask, God bless Anambra, God bless the shining light that we give.
The vision of this administration is to be the first choice investment destination and a hub for economic and commercial activity. The mission, where we go to work every day, is to create a socially stable, business-friendly environment where indigenous and non-indigenous alike will have opportunity for wealth creation. It is this vision and mission that we put into a blueprint, and from that blueprint, we pulled out our 4 pillars and 14 enablers: agriculture, trade and commerce, industrialization, and logistics. Enablers are enablers because they are not an end in themselves, they are a means to an end. Education, for example, is an important enabler. Security is an important enabler. Security is actually our number 1 enabler, because without security, you can't do anything. Education, if you didn't go to school, you probably won't be here. Health, if you're not well, you can't do anything. And a healthy population will be a working population. Since my people are very commerce-based, it becomes important that we face the health sector majorly. We started with the creating of the primary healthcare system, got it passed in the House of Assembly, and they are doing exceedingly very well at this point. My motivation in creating Anambra State Health Insurance Scheme was every time I visit hospital, people will come out in large numbers. Initially, I thought they were coming to cheer me up as a governor. I wouldn't know that there are people that were treated, but they couldn't pay their hospital bills. And the doctors detained them in the hospital. They do menial jobs and what have you until they are satisfied that they've done enough, and before they release them. That, in my view, was a very primitive way of handling health. So we came up with this scheme: 1,000 a month, 12,000 a year. You get treated, no matter the illness. And people have patronized that majorly. 90,000 plus have enrolled, and we're still counting.
Anambra State Health Insurance Agency and the scheme itself that we run, Anambra State Health Insurance Scheme, is a child of necessity, and then a child that was born out of the vision of His Excellency Chief William Adaburo Obiano. People dehumanize themselves in this state, in this country generally. When people are ill, you see women bare their chest in public to show one lesion or the other of the breast. You see people tell you consistently stories of how they had to sell lands, how to borrow money, how they had to sell cars, valuable properties to offset healthcare expenditure. People were dying from preventable reasons. People couldn't go to hospitals because they felt they didn't have money. And the governor had to saddle a team. We must do something. We can't leave this state the same way we met it. We must evolve a healthcare payment and financing mechanism that will ensure that the farmer in the remotest of villages in Anambra could go to the hospital and not look for shortcuts that cuts people's lives short. Going to patronize patent medicine vendors, going to mix all forms of concussions and herbal antidotes to take. Let's get a scheme that will help our people to have affordable health care that is of good quality, that is equitably distributed, and that is easily accessible everywhere. So the governor's team went to work.
I had to study about health insurance scheme of about 14 countries, both national and international. I also studied the national health insurance scheme, and governor gave the mandate. We went on. We came up with the bill that was sent to the House, passed into law, and then we had Anambra State Health Insurance Agency as a law in Anambra State, and then the implementation. And that's what brought it to this level now.
Why this is important is that all of the things people do in the healthcare delivery system, people ask, why does it not last? The reasons are not far-fetched. There is no legal framework to back it up. But with this governor, his own style is different. Let us legislate on whatever we are doing for posterity's sake.
In the next few weeks, I'll be signing off the health insurance scheme.
So, Anambra State Health Insurance Scheme Law 2016 was bettered. In Anambra State, before now, the state health account that was done showed clearly that we have 91.9% out of pocket to percentage of total healthcare expenditure. Whereas the World Health Organization is saying that nobody should do more than 30 to 40%. So you see the precarious situation we found ourselves in. Maternal mortality, child under 5 mortality, and all of these things in the roof. Antenatal coverage in the roof. But for the governor, we needed a mechanism that will ensure that people who seek health care, let the health-seeking attitude of our people improve. And the only way globally that has been recognized to get that done is that when you have a prepayment mechanism, which health insurance offers, when you are ill, you gladly, without the barrier which finance puts, go to the hospital to access care. When you take care of healthcare financing, every other thing follows. Service delivery, health management information system, diagnostics, human resource, all of these will just naturally line up if you solve healthcare financing issue. And the governor has solved it forever for this state. So with Ashia, we now have a mechanism for the son of the peasant to go to the hospital and have surgeries that they couldn't think of doing before. Things that killed our women because they didn't have monies to have facility and skilled birth attendants. Our women, the days of going to patronize traditional birth attendants because they don't have money is over in this state. Persons will be involved in road traffic accidents, and then they are not thinking about paying deposits in hospitals before they will be taken care of because this scheme has taken away that barrier. What we have is a system where people pay a paltry sum of 1,000 naira every month as capitation. In a year, what our premium is 12,000 naira per person who enrolls in our scheme. When that happens, somebody will be granted access to all of these services in our benefit package, from healthcare promotion, preventive services, curative services, and then rehabilitative services, such that we take care of medical conditions, surgical conditions, sicknesses for under 5 children, with focus on maternal and child health care. If somebody has pneumonia, we take care of it. Even COVID, we take care of it because the drugs are already covered in our benefit package. We take care of diarrheal diseases in children and adults. We take care of anything chest infection. We take care of antenatal, labor, and delivery, even if it will be assisted delivery, whether it's instrumental, i.e. Forceps or vacuum, as well as if we have to do in the ultimate case scenario to do cesarean section. We do all of that at no cost to the enrollee. We do heniographies. When somebody has acute appendicitis, we do appendicectomy. We do lumpectomies, all sorts of breast lesions we have excised in this scheme. Okay? We have taken care of people who have been involved in road traffic accidents, and then outside dealing with it, when they recover, we also do the physiotherapy, because we have some days of sessions for physiotherapy. And then for people who have hypertension and diabetes, that's the key. In this scheme, we do not think about pre-existing conditions, because the governor charged us clearly that this is a social scheme for every resident of Anambra, whether you are an indigene or not. But the services will be rendered within Anambra State. As far as Inoma, 4 hours from here, the Igala-speaking part of Anambra State, we have people who have cover of Anambra State Health Insurance Scheme. The only people that are outside Anambra that we take care of are the staff of the state government in the two liaison offices in Abuja and Lagos. So we have a special arrangement for them in Lagos, for example, where there's a particular hospital that they can access Ashia services on. Because these are people who are staff of the state government. Their salaries, they pay premium to Ashia. But then we can't tell them because you are not in the state, you can't access care. So we need to go out of our way to make arrangements for them to access Ashia services where they are. Even though it's costing us more, to pay a bit more, but they are citizens of Anambra in this scheme and they cannot be left behind. We just have to do that. There is something fundamental about health insurance. I'm sure when you go around this state and interact with the owners of hospitals that are implementing Ashia, in any case, over 200 hospitals across the state, public, private, mission, name them, they are rendering services to our enrollees in Ashia across all of the 21 local government areas. One thing we have done is understanding the fact that when you want quality, you pay for quality. Quality is not cheap. When we want our healthcare providers to render quality services to our people, the only way will be to pay them as at when due. So one thing you will always find Ashia do is that we pay our capitation on or before the 12th of every month. We pay capitation for that month to all our healthcare providers. For our fee for service, we pay the fee for service for a preceding month on or before the 25th of the next month. Look, you can't beat that. The fact that when a doctor is performing surgery on a patient and is sure that with Ashia, the money for that surgery will be paid, why would the surgery not go on? That limitation, that uncertainty with payment mechanism that Ashia has addressed keeps the hospitals happy. The fact that with Ashia capitation, a hospital can get bulk money at a time to intervene, to pay staff salaries, to invest in improving their services, buying equipment that they didn't have, instead of going to take loans. I mean, you can't beat it.
Health financing is better now in this hospital. A lot of years, when the month is coming to an end, as the MD, you're not sure how you're going to pay your salaries. A lot of our patients stay very long in the hospital after surgeries, especially because surgery is the most expensive thing services we give them here. Like we had a woman that delivered a set of twins, happy babies. She spent 8 months in the hospital before she could pay her bills. And she didn't even pay by herself. So a church came in and paid for her after 8 months. We had a woman that spent 9 months. We had people that after like 5-6 months, we ask them to please go. Whenever you have the money, you come and give us. And they never come back to give us even 1 naira. Then, here came Ashia. Wow. Well, first of all, met them and asked, is this Ashia, is it only for civil servants? They said, no, that's private patients, people who are not civil servants can come in. Wow. We said, okay. So when we see, when these poor people get pregnant, if they come to us, we tell them about Ashia. Go there and register. They just run there and register. And then at the end of the day, they are happy because all their antenatal will be free, their delivery will be free. The thing is working wonderfully. We don't worry about salaries anymore. Even what the drugs we buy for the whole month, we lump it up. By 23rd of the month, we get paid our fee for service. We pay the drug suppliers. I used to have only one medical officer working with me, just one general practitioner. But now I have 3. Now we have 2 optometrists because we are sure of their salaries. We have set up a dental unit. This is the first small private hospital that was able to get a dental unit because of Ashia. You're sure that on the 12th of every month you're getting your capitation. Wow, you could call the company that supplies dental seats. They'll come and drop it. On the 12th of every month they take their money. Before they take it for 6 months, their money is complete. We have a patient, antenatal patient, who had a borderline pelvis, and we hoped the labor would go through, but at some point the labor got stuck. We took a decision, take her to theater. She gave consent, the husband gave consent, and went to theater. There was no discussion on how much you're going to pay. There was no discussion on how much the whole bill, the total bill would be eventually. No. That burden has been taken away by the government through Ashia. So for them, all they know is, please let the surgery be successful. That's all. So in 30 minutes, the surgery was cool. The baby was out. The woman was smiling.
I keep thinking about it. If Ashia was not in existence, I don't know what it would have become like, because we know how hard things are now. So I don't know where that money would have actually come from. But to God be the glory for a body like this. It's really it's helping.
We're so amazed by the work Ashia is doing that we decided to give up what belongs to us. After every treatment, you're supposed to give a 10% co-payment to show commitment. We, in this hospital, decided to give a waiver for that 10%, just our own contribution to humanity.
I heard about this Ashia in the year 2017. And to the glory of God, I was able to raise her in 2018. I was so shocked that this was what Ashia could do. Because when I went down to the doctor to ask what was my bill, the doctor said I should go. Ashia has covered everything. I was so surprised. And I thank God for Ashia, because Ashia has been of a great help to many. And I encourage those that have not been able to join Ashia to join Ashia. They are missing a lot.
Before Ashia, let me say, there is no universal health coverage in Anambra State, because the health is, they oppress only in national health. That is applicable in federal civil servant, not state civil servant. And some informal sector is not involved in this national health insurance scheme. When Ashia emerged, there is a full health coverage in Anambra State, both the state civil servant and informal sector, including market women, the less privileged. Everyone has the opportunity to key in. I have an enrollee. I introduced her to Ashia because her condition is very critical. She don't even have money to access care. She don't come to antenatal, and she's a pregnant mother. When I heard about her condition, I have to approach her. I approach her husband. They even told me they don't have the premium for this insurance. I will pay for you, but I want you to enroll in this insurance, as God may have it. When she delivered, she paid a little sum amount of money, which is not even up to 2,000 naira, and she went home with her baby. Even said she went to all churches to give that testimony. She even encouraged people to come and register into this health scheme because it is the best. So I think this is a wonderful opportunity for everybody out there, because I still have an enrollee, a family of 4. They barely afford daily food, and the husband is very down. He's a hypertensive. You know, an hypertensive patient need a medical care always. So when I approached them, they enrolled, and today the man is happy with his family. Ashia is wonderful, and it has done a lot to many people, including me. I'm a beneficiary.
I heard about Ashia through our Anambra State government. I didn't believe it when they started, because they said they would deduct our salary. I'm a civil servant anyway. So today I was feeling somehow in my body. I said, let me come and see whether I'll get medical care here. And I came. I've done a scan, test upstairs, though the result has not come out, but I'm getting my scan result. Nobody said pay. The services they gave me here is good for me. And no stress, just pam. I was attended to, and I'm satisfied. I'm
very happy that we started this thing. The impact is immeasurable. It brought the healthcare system, standardized healthcare system in Anambra State. It brought the cost of, paying for health to almost near zero. For instance, as a consultant, if I have to do something like myomectomy in a patient, the patient will pay between up to 200 to 300,000. But the patient up there that we operated just paid the 40,000, which is mainly for logistics, and he's going home smiling.
I got the best treatment. I was even asking the nurses their names. I was like, please, what is your name? So that I will know them by their names because of the way they attended to me. And each moment I look forward to them opening the door and, saying, how are you doing and all that. I really thank God because I don't know. I'm one of the people that have doubted this Ashia thing. I thought it's normal government something that will just come and, but it's not. It's not. And I said to myself, I'm going to talk to my friends. You don't need to get ill for you to go and register. You don't need to have a problem. Because maybe I waited till I had a problem. But then you just need to have it so that in case nobody knows, anything can come up anytime.
It's easy to get people who are in formal employment to register for insurance because you will deduct their premium from source. From their salary, you can just deduct their premium and then enroll them. That's an easy catch. But when you do that, remember that these are people who are already on paid employment, whose salaries are regular, that can plan for healthcare expenditure. If we keep giving medical insurance to only those people, you realize that we will not have achieved much. In Anambra, for example, those in the formal sector are less than 5% of our population. Even if we get to cover all of them, the poor masses would not be able to pay for health care, and that will still cause a lot of catastrophic health expenditure in this state. We were marketing the scheme, but over time, people didn't believe at the initial stages that this was going to work. So a lot of skepticism around the place, and people were not turning up. So what we decided to do was this. We introduced the innovation that we call adoption model, that today, to the glory of God, different states of the country have adopted. And as a matter of fact, in the National Health Insurance Administration law that is currently before the National Assembly, adoption model has become a major way of getting people in the informal sector to enroll for health insurance. Different countries in Africa, about 2, have reached out to us to know precisely how adoption model works, and people are beginning to adopt it outside this environment. It's a simple thought. We looked at it. We have a social support system that depends on family and friends. So why not we go to our people and say to them, pay health insurance premium for all of those who depend on you for healthcare needs ahead of time. That way you can plan. You could say, for this year, I want to spend 120,000 naira paying healthcare bills for people. That in our scheme would translate to paying premium for 10 people. 120,000 naira by 10 people will be 12,000. So you pay Ashia 120,000 naira, we register 10 people for you in our scheme. And we call that adoption model, where those who have will adopt those who do not have into the scheme. And most of those who we encourage our friends and brothers and sisters who are philanthropic to adopt are the poor, the downtrodden. That tomato seller who cannot gather 12,000 naira to go and pay. Meanwhile, she's diabetic and needs her drugs refilled. We need somebody to pay 12,000 for her. That bricklayer who lives by the day and some days could go to look for a job and does not get, but is hypertensive and needs to be on his drugs regularly, needs somebody to put down 12,000 naira and pay for him. But our aim is not to get them and to hope that the philanthropists will keep paying for them. No, because our people doubt the viability of the scheme. So let somebody pay for them in the adoption model. Somebody should adopt them into the scheme. And when they now come into the scheme and go to hospital regularly, assess this care, which is of good quality, let them now be the judge. The taste of the pudding, they say, is in the eating. This year, I will tell you clearly that very few of those philanthropists renewed the adoption packages. We decided to try it out. Let's see the natural history, let's see the cost, and see the individuals that were adopted that will come back to pay health insurance on their own. Over 80% of the persons who were put on board our scheme through adoption model came back to renew their premium on their own. The amount and energy we spend on marketing the scheme has drastically reduced because we have allowed the general public to now market the scheme for us. So for us, it's a win-win situation. No wonder across the state, as of this minute, we have over 90,000 persons signed up and are actively accessing care within our scheme. Because like we say in Igbo land, I would say, that is a good market sells itself. Our people who have benefited have become testimonials for us in the various communities. What we met was a situation where hospitals render services to us, and we put it clear in our memorandum of understanding, service level agreement with the hospitals, that when we come to reaccredit you every year, we must meet certain levels of improvement. If those things are not there, we will cease doing business with you. So, over the months that have passed, we looked at the private hospitals. They were doing their job, using Ashia resources to improve their facilities. And for the public facilities, only one of them was very committed in using Ashia resources. I mean, General Hospital Onitsha was very committed in using Ashia resources to improve what their facilities look like, to ensure that service delivery was taken to the next level. Because I also double as a special advisor on health to the governor, the Commissioner for Health, who is also passionate about this vision of the governor, we sat down to think about it. And we realized that the best way was for us to mandate the hospitals to use the Ashia monies they get as capitation and fee for service to begin to implement specific projects in their facilities.
The saying that he who pays the piper calls the shots applies to healthcare. If you get health financing right, you get the health system right. Let's look at that, for instance, the way Anambra State Health Insurance Agency has been structured and the way it works. Initially, people were in doubt whether this was going to work or not, especially the providers. Now, we noticed that if you get a provider and they get their capitation at the end of the month, that is extra money coming to their pockets. They are happy. Now, because they are getting their capitations, now we realize that we can use that to actually make them meet certain standards in our hospitals. For instance, a provider might say, I don't have the money to provide oxygen in my hospital. And if we say to them, if we don't have oxygen in this hospital in the next couple of months, we remove you from the system. What you see happen is that they hurriedly will provide those things. And this ends up improving the quality of care that the Anambra are receiving from our different hospitals.
For every Ashia provider who is a government facility, we look at the size of your capitation, monthly capitation with us. That's what we pay them for the lives that they are managing for us. When we put all of that together, we use it to carry out capital projects for you. We are an arm of, we are a sector of government. That's what government is. Government is all of us. So not waiting for the light up project to be put in Anambra State Ministry of Health budget. That's not necessary because the governor who set this up is funding it. Why can't we innovatively take from the resources we have to do these things? And today you have that we have powered General Hospital Onitsha. We got them brand new refrigerator for blood banking system in addition to the one they had, so that the capacity for blood banking will be increased in that facility. The MD put her feet down that we needed to do this.
When I took over the headship of General Hospital Onitsha in 2015, the hospital was practically in distress. The buildings were dilapidated, patients were not coming. When you see a patient and admit the patient wouldn't want to stay. So when we now had the insurances coming up, and I asked questions. Can we use your funds to improve the lot of the hospital? They said yes. So we started putting up computerized machines in the laboratory, hematology, microbiology, everywhere. Right now, we're using Ashia funds to put up power, solar power. In fact, we're not using, we have. The lab is, once NEPA goes on, light is there. When we have emergencies at odd hours, it was very difficult for us to pick up the personnel that were supposed to come and attend to patients. The old ambulances we had were spoiled on the road. So I bought a Sienna ambulance to pick up staff, courtesy of Ashia. So those that don't live here, we pick them up. And since then, we have not referred any emergency out that we needed to do. The dental department behind me, it started falling apart. In fact, the cracks in the building, you can see somebody outside the wall. And right now, you can see what is happening behind. You can see the dental department being renovated. And we are happy, you know, when you are a doctor, when you are motivated, when you see your patients happy, when you see you can save lives, because there are so many things, so many deaths that are preventable. I mean, when you see you're now saving these lives, you feel completely happy. Especially in Anji, you know, I'm an obstetrician. I now insist, no patient is sent away from here because we can't pick doctor, because there is no oxygen, because no, it's no longer business as usual. We have to be serious because our patients are human beings. They are brothers and they are sisters. They are mothers and they are fathers. They are uncles and our aunts. So we have to impact on them. And it is courtesy to Ashia, and we're happy about that.
And that is, for us, very, very heartwarming. If you go to General Hospital Enugu, for instance, where we realized that they didn't have a functional ultrasound machine, and Ashia had to buy one. And we started a project of lighting up all of our general hospitals.
Since Ashia intervention, there was a big improvement. Even the patient that testifying about the ward.
When my wife wanted to start her mental, she told me, I told her we were going to register in a private hospital. She said no, she doesn't want a private hospital. She wanted a general hospital or a teaching hospital. I told her, which general hospital? This is our own general hospital, the Enugu General Hospital. He said yes. I said, this place is too local. There is no light. I don't think. He told me no, that the nurses here are experts. The midwives here are experts. That he prefers the midwives here than the ones in the private hospital. I told her why. She told me she's telling me from experience. Her friends told her, her mom told her. I said okay, fine. After much argument, you know women, they will always win. So I decided to give in. I told her that I was going to check if there is light. Then if there is no light, I will have to bring our own generator and install the generator here, at least for the few days she was going to stay. I was surprised the day we came, I saw light. I thought it was generator. Then yesterday night she was in labor. I came back here, there was no light in the entire generator apart from this particular ward. This ward had light and they had even television, even a DSTV. I was so shocked. I said, I was asking the matron here whether this ward is part of the general hospital or is it another private hospital inside the general hospital. She just laughed at me. So I was very, very surprised. If this could be achieved in most of the wards here, I don't think the cases of pregnant women dying and all this unfortunate news, it will be a history.
We are satisfied that our people are getting value. And when they get into these places, as Ashia enrollees, they feel very happy to go into those facilities and see the level of improvement that have come in, irrespective of where the money comes from. This is an agency of government. If we can do it, why not? Then let us do it, because those are the same reasons why the governor set up the scheme, for us to be able to take care of such kind of needs and make sure that the quality of healthcare services our people get is improved upon. When the COVID-19 pandemic broke out, only recently, what we did as an agency Irrespective of the fact that we are not owing any of these hospitals, we thought to ourselves, these are healthcare workers who render services to our people. And the prices of consumables at that time, both hand sanitizers, gloves, and what have you, shot up. The monies we pay, if we wanted them not to start pushing financial burden on our enrollees, charging them outside the 10% cost of medication, that is our co-payment. We didn't want anything like that to happen. What we did was to cushion the effect, and we went out of our way. The governing council of this agency, in its wisdom, approved for us to massively procure hand sanitizers, hand gloves, face masks, and we distributed to all Ashia providers at that time, depending on the number of enrollees any hospital had. Some of them got 5, 6, 4, 2, and even 1 packet of face masks, depending on the number of lives they were managing, how busy they were working with us. We made all of that and gave to them to support them. For us, we are at a level where we are satisfied that God has truly helped us, and the staff here have committed themselves to getting this scheme to work. Because for us, this is one health insurance scheme in Nigeria that doesn't have a third party doing anything for us. Absolutely homegrown government workers doing this in Anambra State. A small size of staff, and then nobody is doing anything for us. We haven't outsourced any of our responsibilities, from marketing of our scheme to enrollment to pre-authorization for hospitals when they want to render services to our enrollees, up to the point where we manage the claims that come to us. It is done absolutely by civil servants working in Anambra State Health Insurance Scheme. So it's a lot of commitment. We are satisfied that this scheme is here to stay. The sustainability which using civil servants to drive this process will engender in this state, I only see that this little spark Governor Willie Obiano has set up with Ashia, having this crop of civil servants stay here under the tutelage they have gotten now. Look, I'm not afraid for this scheme.
Institutionalizing processes is what we're all about at this point in time. And that is why you are carrying the civil servants along, making sure that they are part and parcel of the processes, policies, getting things passed through the House. So we have legislations that strengthens these things so that it lasts beyond their time in office. So our civil servants are part of and parcel of the developments and trends we are actually getting in the healthcare sector. Civil servants are being trained in data management, health management information system. They start learning how important these things are. Capacities get built. When we are gone, that memory will be there for them to respond. And that's what also happened like when we had our response to the pandemic. We started training everybody, started building capacity. So this capacity will learn to do things even when the politicians are no longer there.
And with what we are doing so far in the last 2 years of Ashia's operation, I can tell you that the governor is a satisfied man with the results that we have today. Out-of-pocket health expenditure has gone down. Maternal mortality in this state has gone down. Infant and child mortality in this state has gone down. And then most recently, the health indices report that came out outside the NDHS showed clearly that Anambra State is among the best 5 healthcare systems in terms of states in this country. We are able to do this not because of the 12,000 naira people pay. Let it not be lost on anybody. The key ingredients of health insurance include having a large pool, having subsidy, and then cross-subsidization. The governor has not failed in giving subsidy to this agency. The monies he pays to this agency regularly as provided for in the law. That's what we call the equity fund in the law that says minimum 0.5% of the consolidated revenue fund of Anambra State will be paid to Anambra State Health Insurance Scheme to be able to pay for the healthcare needs of our people. So the governor has not failed in doing that. That's why I said Most of what we have done here is just to run in the vision of the governor. He has clearly put the law, knew the implications financially, and is committed to doing it.
So I'm happy that it's working, and everything that gets measured gets done. Yeah, and because we have a blueprint, all the ministries have their work lined up for them, you know, and we have a way of reviewing your performance, you know, before it dovetails to payments and what have you. We call it Prime Minister Monitoring Unit, and it's working. It's helping us to save money. It's helping us to put an eye on what those guys are doing. It's helping us in so many ways, you know, cutting costs, you know, and, you know, so we are working efficiently, you know, within the little resources that we have. You can see how we managed COVID when it came. The hospital facilities were enhanced. We brought in a lot of beds, equipment, and what have you. In Epulobia, Amako Teaching Hospital, we turned a beautiful complex we had for NYSC into a potential hospital, hoping that people will use it. But fortunately, we never got to use it, and by God's grace, we will not use it. So we will be deploying the facilities there to appropriate hospitals and what have you, you know. People are generally happy because you can avail yourself of any medical opportunity, and people are getting healthier, stronger, and happier.
We will ever remember grateful to His Excellency the Chief Dr. William for starting this and implementing it, and still implementing till this day.
And the Anambra are known for their mobility. We have a high sense of mobility. We're entrepreneurs, and we have a can-do spirit, you know, and that is who we are. We also have that Republican nature, you know. They don't like government doing things for us. We want to do things for ourselves. And that is why when government usually comes, there's this, first of all, they're in doubt. They have to really work hard as government to prove to them, you know. That's when you see policies and programs in Anambra, we go the extra mile to convince people that this will work. And once they see it work, they key in, because having that enterprising spirit, that entrepreneurial spirit, what you see happen also is that once they understand that this is working and is work to their advantage, they key in and key in better than every other person.
So I passionately plead that this vision of His Excellency, which is already moving, should please be embraced by all of us. The days when you go out on your own to pay exorbitant hospital bills, to sell your properties, to borrow money, to dehumanize yourselves because you want to pay for hospital care, hospital expenses, in Anambra State at least is over with what the governor has done with Ashia. It is there for you. It's not restricted to anybody. This vision must happen for all of us, taking out all of the barriers to accessing quality health care. Universal health coverage is possible in Anambra State, and the only vehicle is for all of us to come on board Ashia by simply calling 08021810222. I mean again, 0802-181-0222. It's Ashia 24 hours call line. And when you call it, we'll tell you about our offices across the state. And very soon, you will be seeing us launch our mobile health insurance, where using a USSD code, you can easily pay for Ashia without coming to us. Choose your hospitals, and on your own, have an e-wallet where you can renew your subscription. Happy days are ahead of us with Ashia, and we implore you to come enjoy these goodies of His Excellency with us. Thank you.
God bless Anambra. God bless the shining light that we bring. We're the only ones to make her brighter, the only ones to make her better.